Assalamualaikum. Good morning everyone. My name is Reny Mufaida and I student in the University Muhammadiyah Semarang. Today I'm going to be talking about symptom of gastritis. I will start with definition and then I will go on explain in detail about gastritis. First of all, I will explain about the definition. I will continue with etiology, pathophysiology, clinical manifestation, and complication. To finish, I will explain the management of gastritis. Now that you have heard a bit about structure of gastritis, let's focus on the explanation that I will convey to increase your knowledge. Next, I like to talk about definition gastritis. Gastritis or ulcer disease is a disease caused by excess stomach acid for more stomach acid, so that there is an increase or need for a backup of the gastric mucosa such as a coat of treatment of the gut. At this point, I like to turn to etiology. The cause of gastritis can be distinguished according to their classification as follows. Number 1. Acute gastritis. Many factors cause acute gastritis such as medication such as steroid anti-inflammatory drug. Sulfonamide are drugs that are irritation to the gastric mucosa. Alcoholic beverage, bacterial infection, fungal infection, picomycosis physical stress caused by Brahms. Irritant foods and drink. Spicy food and drink containing caffeine and alcohol are the cause of irritation of the gastric mucosa. Number 2. Chronic gastritis. The exact cause of chronic gastritis is unknown, but there are two important predispositions that can increase the incidence of chronic gastritis, namely infection and non-infection. At this point, I like to turn to pathophysiology. Number 1. Acute gastritis. An irritant that enters the stomach will irritate the gastric mucosa. If the gastric mucosa is irritated, two things will happen. 1. Due to gastric mucosal irritation as compensation for the stomach, gastric mucosal irritation will cause inflammatory mucosa. Number 2. Chronic gastritis. Chronic gastritis is caused by recurrent acute gastritis resulting in repeated gastric mucosal irritation and incomplete healing occurs. At this point, I like to turn to clinical manifestation. Acute gastritis, anorexia, nausea and vomiting, epigastric pain, gastrointestinal bleeding, inhematemesis melena, worsening of anemia, and chronic gastritis. Most clients do not have complaints. Only a small portion complain of heartburn, anorexia, nausea, and complaints of anemia, and physical examination found no abnormalities. At this point, I like to turn to complication. Complications that arise in acute gastritis: upper gastrointestinal bleeding, ulcer, fluid and alcohol disturbance in severe vomiting. Number 2. Complication arising from chronic gastritis: pernicious anemia, impaired iron absorption, and narrowing of the antrum area pylorus. Let me go into some more detail about management gastritis. Number 1. Give a high-calorie diet. Number 2. Give anti- and antibody therapy. Number 3. Give calcium blocking agents prokarya isordil. Number 5. Give topical liquid tip analgesic. To wrap up, let's remind yourself of why this all matter to everyone here. So, you have heard what I have to say? What conclusion can you take away from this? Any question? Okay, great for the conclusion you understand. I hope what I have explained can add knowledge and be useful for all of you. That's enough for my presentation. I'm sorry for the mistake. Thank you all for your cooperation. Wassalamualaikum warahmatullahi wabarakatuh.